Would you survive a heart attack alone? Most people think they'd know what to do during a heart attack. But would you? Imagine your chest tightens, your breath shortens, and there's no one around to help. One wrong move could cost you your life. But there are 5 critical things that can keep you alive if this ever happens to you. Recognizing a heart attack, life has a sneaky way of catching us off guard, and a heart attack rarely comes with a polite warning. What starts as mild chest discomfort can escalate into a full-blown emergency in minutes. The problem? Many people dismiss the symptoms, thinking it's just heartburn or fatigue. Cold sweats, dizziness, nausea, shortness of breath, all of these could be red flags that your heart is struggling with an arterial blockage. And when your heart is crying for help, ignoring it is the worst mistake you can make. The tricky part? The symptoms aren't always textbook. While some feel crushing chest pain, others might just have discomfort in the arm, neck, or even jaw. Women, for instance, often experience subtler signs like extreme fatigue or unexplained anxiety. Imagine mistaking a heart attack for a panic attack. That happens more often than you'd think. That's why if something feels off, don't wait it out. A heart attack is not something to give a little time and see if it goes away. And here's where things go terribly wrong. People downplay what's happening. Your body is flashing emergency signals, yet you convince yourself it's just indigestion. That sandwich didn't sit well, or I'll lie down for a bit and it'll pass. It won't. Or worse, it might pass straight into cardiac arrest. Time is everything. Every second matters. Now, if waiting is a bad idea, you'll want to know exactly what to do the moment you suspect a heart attack. Immediate actions. The moment you suspect a heart attack, every second becomes a life or death decision. The first rule? Call emergency services immediately. And no, don't try to tough it out or see if it gets better. Whether it's 911 in the US or SAMU 192 in Brazil, get help on the way right now. Heart attacks don't wait for convenience, and driving yourself to the hospital is a terrible idea. Your condition could worsen in seconds, leading to a loss of consciousness behind the wheel. Instead, call for help and stay as still as possible to reduce your heart's workload. If you're alone, unlocking your front door before sitting down can be a lifesaver, making it easier for paramedics to reach you. If someone's with you, tell them exactly what's happening. Chest pain, shortness of breath, dizziness, so they can relay critical information to the emergency team. Panic won't help, but controlled breathing might. Breathe deeply and slowly to keep oxygen flowing, and try not to exert yourself. Every unnecessary movement forces your heart to work harder, increasing the risk of complete arterial blockage. Many people hesitate to call for help because they're not sure if it's a real heart attack. That's a dangerous gamble. It's always better to be safe than sorry. Paramedics can perform an ECG on the spot, and early treatment can prevent irreversible heart damage. The worst mistake? Ignoring the warning signs and hoping they go away. But once help is on the way, there's one more thing that could slow down the clot formation and increase your chances of survival. Medication matters. When a heart attack strikes, every minute matters, and one small pill can buy you time. If you suspect a heart attack, chew, don't swallow whole, 2 to 3 100 milliliters aspirin tablets immediately. Why? Aspirin acts as a blood thinner, slowing down clot formation and helping to keep the arteries partially open. It won't stop the heart attack, but it might prevent it from getting worse while you wait for medical help. Think of it as giving your heart a fighting chance until professionals take over. But timing is everything. Aspirin works best when taken Within the first few minutes of symptoms, waiting too long reduces its impact. Also, don't just grab any painkiller. Ibuprofen or paracetamol won't help in this case. Only aspirin has the necessary anti-clotting properties. If you're unsure, check the label for acetylsalicylic acid. That's your green light. And if you have an allergy or a history of serious bleeding issues, skip the aspirin and focus on staying as calm and still as possible. Now, what about vasodilators like Isortal or nitroglycerin? They can help relieve chest pain, but only if they've been prescribed for you. Taking them without medical supervision, or worse, mixing them with medications like Viagra, can cause a dangerous drop in blood pressure, leading to collapse or even cardiac arrest. This is why self-medicating is risky business. So, aspirin? Yes. Random pills from the cabinet? Absolutely not. And speaking of bad advice, there's a dangerous myth out there that could make things worse. What not to do. When panic sets in, bad advice spreads like wildfire. One of the biggest myths? Cough CPR can save you during a heart attack. You might have seen this advice floating around the internet. People claiming that forcefully coughing can restart the heart or improve circulation. That's completely false. If you're having a heart attack, coughing will not fix an arterial blockage or stop a cardiac event. In fact, wasting time trying this could delay real treatment, making the situation far worse. Another common mistake? Taking a vasodilator like Isortal or nitroglycerin without a prescription. Some people assume that because these medications relieve chest pain, they must be a universal solution. But here's the problem. If your blood pressure is already low, or you're on certain medications, like Viagra, these drugs can cause a dangerous, even fatal, drop in blood pressure. The result? You could collapse before help even arrives. Unless a doctor has specifically prescribed it for you, skip the vasodilators. And perhaps the biggest mistake of all, waiting too long to seek medical help. People convince themselves it's just indigestion or that they'll feel better in a bit. But heart attacks don't work on your schedule. They get worse by the minute. If you suspect a heart attack, take action immediately. And if someone around you collapses and stops breathing, don't just stand there. It's time to step in and take control with CPR. Performing CPR, when someone collapses, stops breathing, and has no pulse, you have seconds to act. This is cardiac arrest, and without immediate intervention, the brain begins to die within minutes. The only thing that can keep them alive until help arrives? CPR, chest compressions done the right way. Forget what you've seen in movies. There's no need for dramatic mouth-to-mouth. Your focus should be on compressions. Hard, fast, and in the center of the chest. Here's what to do. Place both hands on the middle of the person's chest and push hard, at least 2 inches deep, at a rate of 100 to 120 compressions per minute. A simple way to keep the rhythm? Use the beat of "Stayin' Alive" by the Bee Gees. It sounds funny, but that song's tempo is perfect for effective compressions. Do not stop until emergency responders arrive or an AED, automated external defibrillator, is available. If you're exhausted, switch with someone else, but keep the chest compressions going. And speaking of AEDs, if there's one nearby, use it immediately. These devices analyze the heart rhythm and can shock the heart back into action if needed. You don't have to be a doctor, just follow the machine's voice instructions. But whether you have an AED or not, doing something is always better than doing nothing. CPR can double or even triple survival chances if started right away. But even if CPR is successful, the real battle isn't over yet. Once in the hospital, every second still counts. Hospital priorities. Reaching the hospital isn't the finish line. It's just the beginning. The difference between a full recovery And permanent heart damage comes down to how fast the medical team acts. The first thing you, or whoever is with you, should insist on: an immediate ECG, electrocardiogram. This simple test detects if you're having a heart attack and how severe it is. Time is muscle, meaning every second lost increases the risk of irreversible heart damage. Don't wait quietly in the ER. Demand urgency. Along with an ECG, doctors will run enzyme tests to confirm if your heart is under attack. When heart cells die, they release enzymes into the bloodstream, acting as a clear sign of trouble. If these levels are high, treatment needs to start immediately. At this point, doctors will likely decide whether you need a clot-busting drug, thrombolytic therapy, or an emergency procedure like angioplasty to clear the blockage. The sooner the artery is reopened, the better your chances of avoiding serious heart damage. And here's a crucial tip. If the hospital seems slow to react, speak up. Some ERs prioritize patients based on visible distress, and if you're not collapsing, you might get overlooked. Don't be afraid to say, "I'm having severe chest pain, shortness of breath, and sweating. This could be a heart attack." That sentence alone can push medical staff to move faster. But remember, while hospital treatment is critical, the best way to fight a heart attack is to prevent it from happening in the first place. Preventative measures. A heart attack doesn't happen overnight. It's the result of years of silent damage caused by poor habits. The good news? You have more control over your heart health than you think. Start with your diet. Cut back on processed foods loaded with bad fats, sugar, and excess salt, and focus on heart-friendly choices. Think lean proteins, fiber-rich vegetables, healthy fats like avocado and olive oil, and omega-3s from fish. If you eat like your heart depends on it, guess what? It does. But diet alone isn't enough. Regular exercise is non-negotiable. Athletes don't need to train for a marathon, but at least 30 minutes of moderate activity most days of the week can do wonders. Walking, cycling, swimming, whatever keeps you moving. Exercise lowers blood pressure, improves circulation, and helps prevent arterial blockage. And while we're at it, stress is a silent killer. Chronic stress fuels high blood pressure, poor sleep, and even inflammation, all leading straight to heart disease. Find ways to decompress, whether it's meditation, deep breathing, or just laughing more. And of course, if you smoke, quit. Tobacco is a direct attack on your arteries, increasing the risk of thrombosis, arterial obstruction, and ultimately a heart attack. High cholesterol and uncontrolled diabetes are also major threats, so regular checkups are essential. Prevention isn't about restriction. It's about choosing life over a hospital bed. But here's the deal. Knowing what to do is one thing. Actually doing it, that's what separates people who take control of their health from those who leave it up to chance. Now you know exactly what to do if a heart attack strikes. But here's the real question. Will you actually take action? Because here's the truth. Most people ignore the risks until they're in an ambulance, if they're lucky enough to make it that far. If you've made it this far, you're already ahead of the game. But knowledge without action is worthless. So take control, get your heart checked, clean up your diet, move more, and stop making excuses. You don't get a second chance when it comes to your heart. And if you ever find yourself, or someone else, in the middle of a cardiac emergency, now you know exactly what to do. That makes all the difference. So, are you going to wait for a wake-up call from your own body, or will you start protecting your heart today? Drop a comment below and tell me, what's one change you're going to make for your heart health? And if you want to keep learning life-saving health tips, hit that subscribe button and turn on notifications. Your future self will thank you.